use an acronym and say APD. You're recognized, and Rose, good seeing you again. You are recognized. Thank you.
Thank you. Good morning, Chair Garrison, Vice Chair Jacques, Ranking Member Woodson, and distinguished members of the committee. Thank you for inviting us here to speak before you today. My name is Rosa Salinas. I'm the Deputy Director of Budget Planning and Administration for the Agency for Persons with Disabilities. I'm honored to be invited here today to present highlights of the fiscal year 2024-25 legislative budget request for APD. Before I begin, I'd like to thank Governor Ron DeSantis and the legislature for its continued support for our agency and for your commitment and leadership in supporting Floridians with unique abilities by providing the resources to best support this sacred population that we have been given the honor to serve. I would also like to thank our providers for their passion and dedication in serving our clients. Our mission at APD is to support individuals with unique abilities and their families in living, learning, and working in their communities by creating multiple pathways to possibilities. The focus of our agency is empowering individuals to thrive. We are working to move from a state of core service delivery historically based on crisis response to a state that will increase opportunities to serve individuals and their families at the earliest moment possible by providing seamless service delivery and increased opportunities for our clients. To fulfill this mission and focus, our proposed budget for fiscal year 2024-25 is $2.39 billion, which represents an overall increase from our current fiscal year of 3.6%. The home and community-based care waiver represents 85% of our total budget and 87% of our total general revenue funding. As part of the creation of these additional pathways to serve individuals, we are requesting the following issues. The agency is requesting $79.6 million to serve additional clients on the home and community-based services waiver by offering enrollment to individuals in pre-enrollment categories 1 through 3, which are crisis, children in the child welfare system, and individuals with intensive needs, to enable these individuals to continue living in a community setting. We're also requesting $2 million, $1 million in non-recurring general revenue, to conduct an actuarial analysis to provide necessary financial information for inclusion in a federal application for an adult pathways waiver. This waiver aims to address intermediate levels of need as individuals transition to adulthood and achieve greater independence and empowerment by providing the necessary supports and services to meet varying levels of need at the earliest moment possible to influence outcomes relating to health, safety, and well-being. Feedback from families seeking services include the need for early intervention and continuous therapy services and supports to achieve advancement and resiliency for both the individuals and caregivers. The average age of individuals who enrolled on the waiver in the past 2 fiscal years through crisis stagnation is 26 years old. There's a demonstrated need to provide a capped amount of highly utilized services to improve outcomes and overall individual and family well-being for this population. This study will help determine these services and the suggested cap limits. The agency is also requesting $29.4 million, which is $12.4 million in recurring general revenue to support the Developmental Disabilities Managed Care Pilot by providing funding for the voluntary enrollment of up to 600 individuals. The agency is requesting $709,000, which is $355,000 non-recurring general revenue, to implement a workforce development apprenticeship pilot program for frontline team members employed by Medicaid providers who directly serve our individuals with unique abilities. This apprentice program works to further professionalize the critical role of direct service professionals and support a lasting career path within the system of care. To support individuals, families, and provider development in rural areas of opportunity, the agency is also requesting $350,000, which is $175,000 of non-recurring general revenue, to conduct a fiscal analysis to determine funding needing to support a rate differential for these rural areas. The agency is requesting $2 million, $861,000 in recurring general revenue to adjust funding rates for nursing services on the home and community-based care waiver to match those current Medicaid rates. We are also requesting $6.5 million, which is $3.3 million of non-recurring general revenue, to continue the investment in learning models to serve individuals with developmental disabilities and co-occurring mental health diagnoses. The pilot includes a co-response from subject matter experts in both behavioral health and developmental disabilities as part of the existing mobile response team framework. The pilot also includes education and training for physicians to effectively support individuals with dual diagnoses. Funding allows for the continuance of this pilot program in Orange and Broward counties and expansion of the program to Leon and Hillsborough counties. This completes my presentation. Thank you again for inviting us to present highlights from my LBR request to the committee. I will be happy to answer any questions you may have at this time.
Thank you, Ms. Salinas. And before we take questions, I think Representative Steele is going to be first up. I want to thank Secretary Hatch personally. She's not here, so she's watching, for coming to my office yesterday and meeting with myself and Representative Busada about some funding issues, the questions we had to clarify some things. It was very helpful, and I just want to publicly thank her for taking the time to do that. Now we're going to start with Rep. Steele, and we'll go to Rep. Bartleman. Rep. Steele, you are recognized for a question and follow-up if you need it.
Just one question.
Yes,
And thank you, Chair. Thank you for what you do. I mean, obviously, these are individuals in our communities that need the most help. I just want to know on the total budget line, how many actual individuals in the state that we actually help for the $2.4 billion?
And you're recognized.
Thank you. On our waiver, we currently have approximately 35,600 that are currently on our home and community-based services waiver. We also have approximately 21,000 on our waiting list. Some of those individuals receive services through our individual and family supports category. And we also have room and board services that are provided on a limited basis. And we also support 3 developmental disabilities 24/7 centers so in total, we approximately 61,000 individuals that we're providing services for on some level.
Good. So, but the 61,000 excludes the 21 that are on the waiting list, right, of aid?
You're recognized.
In
40,000 roughly.
Roughly, yes, sir.
All right, thank you. Yeah, Rep. Bartleman, you're recognized.
Yes, thank you, Chair. And it's interesting because I've had a ton of meetings and they all talk about issues finding service providers because of rates. And then literally right before this meeting, I was speaking to the Association of Rehabilitative Facilities. And so what I am hearing that even if we gave you all the money to come off the wait list, and only they have a survey actually, which is shows 34% have responded. And just from the last presentation with the staffing shortage, what I am hearing is that the provider rate reimbursement rate, the service provider rate is a problem because they are unable to hire staff. So even if we took all the money for the wait list, they are unable to find the workforce, which is not unique to this area because in every other area of healthcare, we're hearing this. And then I saw in your presentation that you were going to look at the rural areas. And I want to challenge you a little bit further because if you live in one of the populated counties, they can't afford housing. So they can't afford to take the job. So they're having now the issues that were mainly rural issues are now because of housing and insurance happening in the large counties as well. So my question is, knowing that we return over 100, we return funds back to the general reserve every year that are unspent, knowing that services have decreased by 38% overall for your service providers, how, and it's a big question, and I'm sorry, I just got this information, but it makes perfect sense. I want to dig deep with you and my chair because he's on top of all of this as well. How can we help you with the service providers? Because if we don't have the workforce, the services aren't being provided. So what do you see as a solution beyond the rural, beyond the study and the budget request? What else can we do?
You're recognized to answer that very concise question.
Thank you. Thank you, Representative Bartleman. That's a great question, and there are, we are working to look at things in a new and different way, and we're willing to work with our partners in the legislature and governor's office to address these issues. There are, as you see in the presentation, we are trying to do some things. The rural areas opportunity, of course, is to help address some of those rates within rural areas and less populated zones. We also, the apprenticeship pilot program that I mentioned, that is designed to help sort of elevate the role of the direct service professional and help them receive more training and recognition for the important work they do, and encourage that as a profession, a long-term profession, like many of those people have done, which will hopefully help increase the ability for them to be able to, receive more pay for those services. And there are I'm sure lots of other areas we'd love to talk to you about.
I'm sorry, I'm a little taken aback here. I saw Rep. Amnesty has a question. Representative, you are recognized.
Thank you very much, Chair. I want to thank you for everything you do for persons with disability in the state of Florida. And one of the questions that I have is looking at the presentation. One of the charts provides information on faith-based institutions. How many faith-based institutions partner with the agency to provide these services?
And you're recognized.
We have been working, going around the state. They have done a lot of visiting and working with different partners. I don't have a specific number for you, but I'd be glad to get that information. We do have a lot of interest from all of our partners that we're trying to look at, again, multiple pathways to serve our individuals, because we realize no matter how much money you give us, there's, that we'll always need more. So we're looking at how we can incorporate resources from every angle.
If you wouldn't mind distributing that to the rest of the committee, I know I'd be interested in that as well. Thank you, Representative. I think Representative Steele had a follow-up, and then we're you sure? You good? No, go. Okay, perfect. If you would just follow up with Representative Steele after committee, that'd be great. Any other questions, members? Any other questions? All right, thank you very much. And I know we say this every time y'all come here, but I want to reiterate, you really are doing the Lord's work, and we appreciate what you do. It's very difficult and demanding, and just know that you have our full support as you do your important work. So
Thank you very much.
Appreciate it. Thank you. All right, last up, I think here we go. Saving the best for last. We have the Department of Veterans Affairs.